Hello everyone. In part 1 of this competency PS 3.7, I discussed the K component of the essential medicine and essential medicine list. In this part 2, I shall be discussing how to prepare an essential medicine list for primary healthcare facility. Now, if to identify a primary health center for undergraduate training and secondary healthcare center for postgraduate training. There are 3 steps in making the essential medicine list for any healthcare facility. Step 1 is identifying priority diseases, that is population which is covered by the healthcare facility, distribution of population by age and sex, and percentage of the vulnerable populations, elderly, pregnant mothers and children. And then we will prepare the list of communicable and non-communicable diseases which are prevalent in that area, and we will prioritize the list most frequently occurring disorders and very uncommonly occurring disorders. We will also note that any disease outbreaks have occurred in the recent past, and this way we will finalize the priority diseases for which essential medicines are to be selected, and this should be done by a consultative approach, that is involving the doctor, the nurses, the local authorities and community. Now, step 2 is selection of essential medicines for essential medicine list. The basic criteria of selection is same, that is the drug should be have efficacy, safety, and should be of quality, and availability. Availability means local availability, and cost effectiveness has to be seen. Now, the information can be obtained about the cost and about these criteria in a number of drug reviews, textbooks of the medicine and textbooks of the pharmacology. The cost can also be calculated from available cost charts in the drug reviews. Unit cost should be calculated, and also total cost of the treatment, for example 5 days to 1 month. Alternately, the disease-wise essential medicines can also be selected from the National Essential Medicine List. At this level, at UG level, this will be much easier because the medicines which are included in National Essential Medicine List are already passing those criteria of efficacy, safety, quality and effectiveness. So both the things can be done. And inclusion of the essential medicines in essential medicine list will always be by consultative approach. Therefore, all the stakeholders and policy planners or policy makers are included. By doing this, we will also estimate the approximate quantity of each essential medicine needed for that. Step 3 would be implementation and monitoring. That is usually done later on, and this is important because it ensures availability, proper supply and distribution, it ensures training and supervision, it ensures public education, and it develops a transparent procedure for revising the list in the future. We should also make a provision of use of non-listed medicines if situations demand. It's not that only essential medicines are to be used, but some number of the non-listed medicines which may appear to be very important if situation arises, means some outbreak occurs or like that, then it should also be included. NGOs and government officials should also be involved for proper implementation. Now, one example I'll give here, although a number of examples have been given for selection of the drugs, for example pain relievers or the antipyretics. Here I will give one example that apart from aspirin, if we require additional antiplatelet medicine to be included in essential medicine list, then we will identify what medicines are available. Two common medicines available are, which have almost similar mechanism and efficacy of action, is clopidogrel and prasugrel. Now, if you compare the efficacy in detail, we will find that clopidogrel is well known to be effective in reducing thrombotic cardiovascular events. Prasugrel came later, but it also significantly lowers thrombotic events as compared to clopidogrel. So we can say that efficacy-wise, prasugrel is better. Regarding safety, clopidogrel increases the risk of bleeding. However, the risk of bleeding, including fatal and non-fatal uh, events due to bleeding, occur much more with prasugrel. That means cerebral bleed can occur at a higher rate than seen with clopidogrel. Both are suitable, can be given once daily. Let us see the cost. And the cost of the clopidogrel branded is about 13 rupees per 10 tablets. Therefore, for cost of 90 days treatment, which is considered to be standard care, would be rupees 120 to 300. However, if you choose prasugrel, then cost will be over 1000 rupees for 90 days treatment. Now, in this scenario, efficacy-wise and safety-wise, by compromising little efficacy, we are enhancing the efficacy of the safety of the patient, and therefore I prefer choosing clopidogrel in place of prasugrel at primary health center. Now let us see the representative example. We have identified, suppose, a primary health care facility or primary health center which caters to 20,000 population. The population has a mix of children, adults, elderly, males and females, and we have then reviewed the disease records of the healthcare facility and found following elements to be common: viral fever with vomiting, headache, GIT disorders, gastritis, vomiting, diarrhea, dysentery, musculoskeletal disorder, giddiness, vertigo, syncope, conjunctivitis, glaucoma, foreign bodies in eye and ear, common cold, allergic rhinitis, otitis externa, pharyngitis, then bronchitis, bronchial asthma, diabetes, ischemic disease, hypertension, injuries, bleeding wounds, antenatal care, menstrual disorders in females, and emergencies. Patient come with poisoning, with allergies, anaphylaxis, bee bites, snake bites, and sometimes come with hypotension because of heat exhaustion. Now look into these priority diseases. Now we will go ahead for making a essential. Now, for each symptom or disease, we will identify medicines. As we know, for fever, aspirin is available and paracetamol is available, but we will prefer paracetamol because of efficacy and safety, and because of lower cost. And National Essential Medicine List also at primary level recommends paracetamol in various dosage forms. Similarly, for anemia due to iron deficiency, ferrous sulfate is the standard care, and if required, iron sorbitol complex IV can be given, and they are also found in essential medicine list at national level. If there is a bleeding due to menorrhagia, then vitamin K1 and tranexamic acid can be given. Ethamycilate is also effective, but tranexamic is chosen because of efficacy and safety. For vertigo, giddiness, dimenhydrinate, cinnarizine, beta-astatine, flunarizine. We can discuss about why beta-astatine is not chosen because of the cost and availability. Therefore, in any LM, flunarizine 5 mg tablet is chosen. For endogenous depression, amitriptyline should be chosen. If the cost is lower, then escitalopram can also be found. Both are actually found in National Essential Medicine. In a similar token, anti-allergics, glucocorticoids, drugs for body aches and pains, musculoskeletal disorders, dysmenorrhea, diclofenac, aceclofenac, naproxen are there, ibuprofen is there, mefenamic acid is there. All are actually included in National Medicine List. I have already discussed tablet ibuprofen should be preferred, and injection diclofenac should be preferred. For diabetes, endocrine disorder, soluble insulin, mixed insulin, intermediate insulin, and 3 oral antidiabetic drugs can be found to be effective, safe, and cost effective also. Glimepiride among the sulfonylureas, teneligliptin from the gliptins, and metformin as an standard care is needed for type 2 diabetes. The corresponding dosage forms are also included in the national list of essential. For females, contraception standard is ethinyl estradiol with levonorgestrel. Mala D is also available. Ormeloxin may be required for some. Progestin, levonorgestrel, norethistron, oxytocin, methyl ergometrin after the delivery. And for hyperthyroidism, carbimazole, only one drug. Methimazole and all behave like that. They are equally effective and equally their safety profile is also same. Therefore, carbimazole is enough, and for hypothyroidism, levothyroxine is the only drug which can be included. It is very important to consider the cost and long for the drugs for long-term treatment. Antihypertensives are many. Among the dihydropyridines, amlodipine is chosen. Among the enalapril, lisinopril, ramipril, well, I would prefer lisinopril or enalapril. Ramipril has been included because ramipril is also effective in chronic heart failure. It improves the myocardial performance. Diuretics, hydrochlorothiazide is chosen and furosemide is chosen. Chlorthalidone is costlier compared to, whereas it is equally effective. In some cases of chronic heart failure, spironolactone may be required. For pregnancy, antihypertensive will be either labetalol or some other drugs such as alpha-methyl dopa. Here we have chosen labetalol because of its availability and safety and efficacy. For non-pregnant, beta blockers would be propranolol, metoprolol, telmisartan. They are not for the pregnant mothers. They are only for the general population with hypertension or heart failure. For ischemic disease, nitroglycerin, isosorbate dinitrate, clopidogrel I have already chosen, atorvastatin, pravastatin, rosuvastatin. Rosu appears to be effective and but costlier. Therefore, atorva is the standard treatment care and is included in essential medicine. Among the airway diseases, for asthma, combination of salbutamol along with budesonide, formoterol, ipratropium, montelukast, and aminophylline, derifylline are chosen, already chosen national essential medicine, and they are found to be very effective. As nasal decongestant, xylometazoline can be chosen. There are others also, but xylo is time tested and efficacious. For eye drops, for eye and for nasal drops, antibacterial ciprofloxacin can be chosen because of its effectiveness. And for GIT disorders, metoclopramide, ondansetron, domperidone. For because metoclopramide and ondansetron are available as injectables also, whereas domperidone is only orally effective. They are cost effective and effective treatment for various types of the vomiting. For abdominal colic, dicyclomine should be chosen because of availability, efficacy and safety. It is also available as injectable and oral preparation. Among the anti-secretory drugs for the hyperacidity, ulcer disease, and reflux esophagitis, we have already discussed omeprazole as a standard of care and very important effective drug with comparative safety. Therefore, oral omeprazole can be chosen. If there is an emergency, then injection ranitidine is also available. For metronidazole is an important drug which can be used for the treatment of amoebic hepatitis and amoebic dysentery. Ornidazole, tinidazole can also be used, but ordinazole is somewhat costlier than metronidazole. They are equally effective. ORS is the standard WHO formula, and for constipation, bulk forming isabgula and bisacodyl as a stimulant purgative can be. For, for osteoarthritis, vitamins, anemia in pregnancy, all the under national program, these medicines are available in fixed dose combinations and alone also, and they can be included in national list of in the local primary healthcare. For skin disorders, fungal allergies, salicylic acid, clotrimazole is very cost effective. Betamethasone for allergic dermatosis, and for wounds, hydrogen peroxide, povidone iodine antibacterial from acid. It's better to use povidone iodine. Silver sulfadizine, fusidic acid is much costlier, but is also available. Chlorhexidine wash solution is also available. Potassium permanganate can be kept because it can be used on the wounds and bites. Ethyl alcohol is used as local cleansing antiseptic, calamine also as an antiseptic, emollient, and benzoyl peroxide for acne. Permethrin is time-tested standard of care for scabies, and acyclovir cream for herpes at primary level. For eye disorders, glaucoma, latanoprost, pilocarpine, temolol eye drops. For acute iridocyclitis, atropine as a mydriatic. For common disorders during specialist care, homatropine, phenylephrine can be used. Phenylephrine is an advantage that it can also be used as decongestant allergic conjunctivitis. For dry eyes, carboxymethyl salicylate can be. For malaria, limited number of there are large number of medicines. It is better to include limited number which have equal facility, equal efficacy and safety. Chloroquine is time tested. Primaquine is for radical care, and chloroquine resistant quinine sulfate oral injectable can be given. Doxycycline is for resistant malaria, and artemether lumifantrin combination is standard of care for the falciparum malaria oral. For bacterial infections, large number of antibacterials are available, but the number should be limited. One cephalosporin from the group 1 of cephalosporins, cefixime from group 3 of the cephalosporins, then amoxicillin as beta-lactam, erythromycin as macrolides, ciprofloxacin for abdominal and systemic body infections, and cotrimoxazole for various urinary tract infections. They all are included in national list of medicine. Now, doxycycline, gentamicin is injectable, metronidazole has already been included. Now there is a question of dihydrohydroxyquinoline, dialoxanide furoate. The list any LM doesn't include these two. Dialoxanide can be included because they are luminal amibicide. The only problem is if it's not a priority disease in that area, then it should not be included. For UTI, NFT or cotrimoxazole, nitrofurantoin is there. For fungal infection, oral fluconazole liquid can be used, and local pessary of clotrimazole in females. For convulsions, diazepam, oral, injectable, suppository, sodium valproate, oral or liquid, phenytoin as oral or injectable, and carbamazepine as oral. These are required for various types of epilepsies in children and adults. So it covers a wide range of priority diseases. Sometimes drug-induced extrapyramidal syndrome comes. Then triaxiphenadil is a cheaper medicine which can be kept. It's very effective. For insomnia, zolpidem under control for limited period with patient education. For worms, albendazole, mebendazole, ivermectin. The advantage of albendazole is that it will be effective in more than one worm, and so is the mebendazole. Ivermectin is also effective in scabies and head lice. Immunoglobulins and antitoxins are always available under immunization program, and they are always part of the essential. Now, medicines can also be kept according to emergencies seen in the facility. A common list of emergency medicines include adrenaline, atropine, intravenous glucose 25% for hypoglycemia, IV saline, DNS, potassium chloride, sodium chloride, 5% glucose for intravenous fluid replacement in hypotension and exhaustion, and lignocaine injectable topical. Both are available. Lignocaine with adrenaline is also made available in EML. Midazolam is kept for several purposes, and now even nasal spray has been recommended for EML. Phenytoin I already discussed. Phenytoin maleate is injectable antihistaminic anti-allergic that may be given if there is the insect bites, severe allergy, and anaphylaxis after adrenaline. Hydrocortisone is also invariably required in a number of conditions, acute bronchial asthma and anaphylaxis. Dopamine to raise blood pressure, calcium gluconate to provide calcium and treat tetany, and pralidoxime if there is organophosphate poisoning. The number of medicines in the emergency use will depend on the level of the health care. For example, in secondary, more medicine will be required than in primary health care setting. So the presentative list medicine. Even government has prepared a document under Ayushman Bharat Health Care where list is there for secondary and primary health center level, and when I would prefer that every student should go through this list and should be kept at the skill station. The reason is because whatever I have discussed earlier and I have derived from the national list of the essential medicine is also seen in this document, and therefore a student can find out the essential medicine from this list and discuss why this medicine is included, why this is not included, and it will be a good discussion, and then it will be very good for their development of its future skill. Further reading can be done. I hope I have discussed everything, how to prepare essential medicine and how to prepare essential medicine according to the level of the health care